module was about a month long, and it would be, we had a cardiology module, we had a pulmonary module, a gastrointestinal module. So each of those, you learn both kind of like the book learning stuff, you learn the physical exam, and then you also have anatomy during that time. And so you kind of get tested on all those things around one body system at the time. And I thought it was a really great way to learn because you kind of think about the system as a whole instead of just, some medical schools, like you'll do just histology, which is just like looking at cells on the slides, or you'll do just pharmacology, just the medicines to treat. So this was a nice way to think about, oh, this patient has heart failure, this is what that looks like, this is, the parts of the body that are affected, and these are the medicines to treat, kind of all in one week. Yeah.
What was the hardest subject or concept that you had to learn?
What was the hardest? Oh, I think for me, what I probably struggled with the most was pulmonology, because it's a lot of physics, of kind of mechanics of how the air goes in and where it moves and resistance in a tube. But yeah, I think looking back on it though, I was so excited to be learning all this stuff. I felt like it was a lot of work, don't get me wrong, but I knew what the goal was, if that makes sense. I feel like sometimes in school, you can look at yourself and be like, why am I learning this? When am I ever gonna use it? And everything I learned in my first 2 years of medical school, I was like, I'm gonna need this. Someone's gonna be my patient, they're gonna, know that I skipped reading, chapter 2. And so I really felt that pressure. And I think that was great because everything comes back and everything's important to learn. So even though I want to be a dermatologist, it's important that I understand how the kidneys work. And it's important, that I understand, how children develop, things like that. So I don't think that there's anything that's not useful.
Have you applied to residency yet? The program?
Yes, I applied a couple months ago. And so how it works, kind of like I said, so I'm applying to my intern year programs, which will be in general medicine, and then in dermatology programs, and doing some interviews now.
So how does that work? So I know, just it's a ranking system. Can you explain how that works?
Oh yeah, I can explain the match. So it's kind of crazy. So I think it came up a long time ago, but all these brand new doctors graduate, and so there has to be a way to have all the new doctors match into all the different residency programs throughout the nation. So someone a very long time ago, I think they won the Nobel Prize for it, which is actually pretty cool, came up with this large algorithm called the match. And so whatever programs decide to interview me, I'll have a list, and I'll be like, oh, I really want to go to Emory #1, and I'd like to go back to University of Michigan #2, and I'll rank, all my different hospitals. And then each program, so Emory will sit down and say, okay, we want, Susan first, and we want Marissa second. And so each hospital and each person puts in a rank list, and then it all spits out on one day in March, and you figure out where you get to go. And so the idea is that both students who are applying and hospital programs get what they want. And so it's not always perfect, and there's some people who maybe don't get the specialty they want or the area that they want, but it makes the most people happy. So that'll be in March. Keep you guys posted.
What happens in March?
That's when the match results come out. So there's just a Friday that I'll find out where I get to go. Yeah, and then I'll graduate in May.
So what does a day in your life look like now? Because I know she asked about in the first 2 years of medical school, but what does it look? What do you do now on a daily basis?
Sure. So I was just on my critical care rotation, which is at Emory Midtown Hospital, and so on any given day, I'd get there around 6:45, and I would talk to the resident who was overnight, so one of the training doctors, and hey guys, come on in. I'm Marissa. So I'd get in around 6:45, talk to the overnight resident, and then I would go into the computer system and look at my patients' kind of overnight data. So their labs, their vitals, if they got any studies done, And I'd write it all down on my piece of paper. And then I'd go and check on my patients wherever they were in the hospital. So in critical care, they were all in our one ICU. And so I'd ask them, how are they feeling? What happened overnight? Any specific questions that we have for them. I do my physical exam. No problem. Which is always listening to their heart and lungs, evaluating specific problems that they have or things that they came in for. Checking to see, because we're in the ICU, if they have any IV medications running, if they're intubated, so if they have a machine helping breathe for them, what the settings the machine is on. Get all ready, talk to my resident, and then we'd round around 8:30, 9 o'clock, which means going to each patient's bedside as a full team. So our team for that was actually really neat. So we had an attending doctor, fellow, which means that they're already a doctor, but they're like super subspecializing. Come on through, guys, you're good. We had 3 residents, and then myself and another medical student. We also had a pharmacist and a pharmacist trainee and a dietitian. So like all 10 of us would sit around and we'd talk about each patient. We'd come to their bedside, and myself as a medical student, I'd present them, which means kind of giving the team a very structured update on what's new with that patient and what our plan was for the day. And so the nurse would come to and listen, so we could kind of all be on the same page about what's going to happen for them. Rounds generally takes a couple hours, and during rounds is a lot of when the teaching happens. So my attending physician, so the top person on the team, asks a lot of questions and make sure I know all the right things about my patients, that I've been reading at night and studying up on what I need to. And then we'd have noon conference, which is scheduled. There's generally one at each hospital, but it's just, a kind of PowerPoint presentation on something that all people in the hospital need to know about. And then we do afternoon rounds again, and then I go home and study. So kind of a long day, but really great for learning and getting to interact with patients and kind of really function as part of that healthcare team as I'm still a learner. So, yeah.
How long is your work/school day?
So it depends. So on critical care, it was pretty long. I'd say I was there like 6:45, and I never left before 5. That's because those patients were really sick. And then I'd go home and read, because at the end of each month rotation, it's, I'm in school, so I still have an exam and had to learn specific things for that month. But other rotations are lighter, and I think like for this month, I'm on a research month, so I really have a lot of flexible time. So I think it just depends on rotation. Sometimes I remember on my surgery rotation, I'd get to the hospital at like 4:30 a.m., which I wasn't getting my required 9 hours of sleep. But so kind of goes in waves, and you're excited to be there, so it's not so bad in terms of long days. It's kind of fun.
Who's your attending physician for critical care medicine?
Who what? So it was a different person every week. I just had a couple. Is there someone you want to ask about?
Do you know Dr. Kuberschmidt?
The name sounds familiar.
Yeah.
Okay. Yeah, I didn't know.
know.
Oh, nice. Yeah. Awesome.
You know Dr. Raji?
Oh no, am I gonna get asked about all my specific attendings? So all these names sound familiar, but I don't think I've had them as my attending. Yeah. Because that's what's so cool about Emory is I said people who practice at the VA, who practice at Grady, who practice at Emory, you get to interact with all kinds of different teachers and learn their style and learn different things from each of them. So it's pretty neat.
Do you feel like you have more of a work life experience, or more like a student experience where you go to school?
So my first 2 years, I definitely felt like a student, because it was 8 a.m., show up for lecture. It was all very structured in terms of what my day was like. It was definitely like a printed class schedule. I was expected to be there every day. But in the clinical years, you're in the hospital, and you might be the only medical student on your team. And so that more definitely felt like work, right? You have coworkers, you're showing up, you're talking to the residents. It definitely felt more like work. But I think there's a mixture. you can't forget as a student that you have to go home and study. Because you gotta make sure, cause I'm, you know, as opposed to the residents, I got a grade for each of my, rotations, so I had to make sure I was learning the right things. Lots of studying, no matter what.
Was there any like assignment that was just overwhelming, say?
So just kind of like you have to take the MCAT to get into medical school. Within medical school, you have to take a lot of board or licensing exams. And so, so after you complete all your preclinical things, you do it's called step 1. It's a really tough exam. And then you take step 2, which is another tough exam. Then you take a clinical skills exam. So there's kind of really tough exams throughout it. But I'd say step 1 was really the hardest one because it matters a lot for your residency application. But I think anybody who gets into medical school and tries hard, you know, you can do step 1. So, guess.
Do you have any suggestions for us to like get on the right track while we're still in high school if we're still unsure about going to medical school?
Study.
Yeah, studying's always a good one.
Like if we're unsure if we want to do it, like how should we test